Bismillahirrahmanirrahim. Quote for today is deficiency of satisfaction causes regret. Today the topic of my presentation is iodine deficiency disorders and I am presenting it under the supervision of my professor Dr. Saira Afzal. Learning outlines are introduction of iodine, causes of iodine deficiency, diseases related to the deficiency, prevention of these diseases, treatment of these diseases, deficiency at national level and recent updates at the end. At the end of this presentation, participants will be able to describe about the iodine deficiency disorders, its causes, along with the prevention and treatment of these. Now, introduction of iodine. Iodine is an essential dietary mineral for neurodevelopment among children. The thyroid hormones thyroxine and triiodothyronine contains iodine. In areas where there is little iodine in the diet, typically remote inland areas where no marine foods are eaten, iodine deficiency is common. Iodine deficiency occurs when the soil is poor in iodine, causes a low concentration in food products and insufficient iodine intake in the population. It is also common in the mountainous regions of the world where food is grown in iodine-poor soil. There is a total of 15 to 20 milligrams of iodine in the human body, primarily concentrated in the thyroid tissue and hormones. 30% of the iodine is distributed in other tissues, including the mammary glands, eyes, gastric mucosa, choroid plexus, arterial walls, cervix, and salivary gland. Epidemiology. Iodine deficiency resulting in goiter occurs in about 187 million people globally as of 2010. Certain areas of the world due to natural deficiency and unavailability of iodine are severely affected by iodine deficiency, which affects approximately 2 billion people worldwide. It is particularly common in Western Pacific, Southeast Asia, and Africa. Among other nations affected by iodine deficiency, China and Kazakhstan have begun taking actions. Intake only of locally grown food in Central Africa can cause iodine deficiency. Iodine deficiency and hypothyroidism. In primary hypothyroidism, decreased production of thyroid hormones by the thyroid gland causes a compensatory increase of thyroid stimulating hormone. Increased level of thyroid stimulating hormone is the earliest sign of iodine deficiency induced hypothyroidism. Secondary hypothyroidism is caused by pituitary disorders that causes decreased thyroid stimulating hormone release and decreased free T3 and T4 levels in the blood. Since iodine is used to make thyroid hormones and iodine deficiency means that your body cannot make enough of them, that leads to hypothyroidism. This slide shows the feedback cycle that was shown in the earlier slide, that thyroid from hypothalamus, that is pituitary gland, and thyrotropin releasing hormone is secreted. That leads to thyroid stimulating hormone secretion to the thyroid gland. And from thyroid gland, T3 are produced, and negative feedback inhibition then goes from thyroid to hypothalamus. Risk factors for iodine deficiency. Following is a list of potential risk factors that may lead to iodine deficiency. First and most basic is low dietary iodine. Second is selenium deficiency. Third is pregnancy. Exposure to radiation can lead to iodine deficiency. Increased intake and plasma level of goitrogens such as calcium can also lead to iodine deficiency. Sex, because it's mostly higher in women. Smoking, tobacco, alcohol, oral contraceptives, perchlorates, thiocyanates, these are the drugs that can lead to iodine deficiency. And age. Age is for different type of iodine deficiency, occurs at different ages. Symptoms of iodine deficiency. More common symptoms are fatigue, increased sensitivity to cold, constipation, dry skin, weight gain, puffy face, hoarseness of voice, muscle weakness. As this person is shown in the figure, is having all signs of hypothyroidism. Swelling in the neck is the most common symptom that is mostly seen. Hair loss, dry flaky skin, feeling colder than usual, and changes in the heart rate are the signs. Goiter. A low amount of thyroxine in the blood due to lack of dietary iodine to make it gives rise to high level of thyroid stimulating hormone, which stimulates the thyroid gland to increase many biochemical processes. The cellular growth and proliferation can result in the characteristic swelling or hyperplasia of the thyroid gland or goiter. Goiter presents the classic sequel of chronic iodine deficiency. When the iodine intake decreases, the secretion of thyroid stimulating hormone is enhanced for the reason to increase the uptake of available iodine. Thyroid stimulating hormone concentration in turn stimulates hypertrophy and hyperplasia of the thyroid that results in goiter. Initially, goiters are characterized by diffuse, homogeneous enlargement, but over time, nodules and subclinical hyperthyroidisms often develop in adults. In mild iodine deficiency, levels of triiodothyronine may be elevated in the presence of low levels of levothyroxine, as the body converts more of the levothyroxine to triiodothyronine as the compensation. Some such patients may have goiter without an elevated thyroid stimulating hormone. The introduction of iodized salts since the early 1900s has eliminated this condition in many affluent countries. Symptoms of the goiter are an enlarged swelling on the neck, difficulty swallowing because of that swelling, trouble breathing because the swelling can push your trachea backwards, and symptoms of hyperthyroidism in case of the nodule or hypothyroidism in case the nodule has not still developed. Goiter is usually harmless if it unattractive. Nevertheless, nodules may cause tracheal obstruction and impair the function of laryngeal nerves that can lead to hoarseness of voice. When surgery is required or elected, the risk of surgery in the local setting must be considered, and these may not be negligible. In the figure, there is a woman that is shown a goiter that is more enlarged on the left side. Now, congenital iodine deficiency syndrome. Previously, this is known as cretinism, is a condition that is associated with iodine deficiency and goiter, commonly caused by mental deficiency, deafness, squint, disorders of stance and gait, and stunted growth due to hypothyroidism. According to World Health Organization in 2007, nearly 2 billion individuals had insufficient iodine intake, and the third being of school age. A conclusion was made that the single most preventable cause of intellectual disability is that of iodine deficiency. This picture shows a baby that had cretinism. Cretinism, the children who suffer cretinism lack the necessary thyroid hormone in utero or shortly after birth. They have retarded physical and mental development, ossification of bone is delayed, tooth development is poor, tooth eruption is delayed, permanent neurologic damage is evident. Clinically, the infant is dull and apathetic. Body temperature usually is below normal. Physically, the tongue is enlarged and protruding, skin and lips are thick, face is broad and puffy, and nose is flat. Physical growth hypothyroidism, a consequences of iodine deficiency, can clearly retards growth and development, and iodine deficient individuals frequently are shorter than their iodine sufficient peers. Iodine deficiency and reproduction. Low thyroid hormone production can interfere with the ovulation by preventing egg release. It can also affect embryonic development, increasing the risk of miscarriages. Premature delivery, low birth weight, and diminished fetal mental capacity are also associated with this condition. Hypothyroidism is treated through thyroid replacement therapy. Hypothyroidism, how the condition can usually be managed by taking a single daily pill. Iodine deficiency and skin. Hypothyroidism is sometimes caused by autoimmune disease. This can affect the skin, causes swelling and redness that is known as myxedema. Myxedema is also used to describe the dermatologic changes that occur in hypothyroidism and occasionally hyperthyroidism. Now, what is myxedema? A person with myxedema may notice a swelling in their face, legs, or tongue. Their skin may also become dry and pale. Other symptoms of severe hypothyroidism can include intolerance to cold, etc. Facial expressions may become dull, the voice is hoarse, speech is slow, eyelids droop, and the eyes and face may become puffy. Myxedema coma. Myxedema coma, occasionally called as myxedema crisis, is a rare, life-threatening clinical condition that represents severe hypothyroidism with physiological decompensation. This condition usually occurs in patients with long-standing undiagnosed hypothyroidism and is most often precipitated by infection, cerebrovascular disease, heart failure, trauma, or drug therapy. Symptoms of myxedema are hypothermia, myxedema coma or myxedema crisis are hypothermia, hypotension, bradycardia, decreased pulse pressure, normal systolic pressure, and elevated diastolic pressure. Decreased respiratory rate, periorbital puffiness, macroglossia, and chorus or thinning of the hair. Iodine deficiency and cardiovascular system. In hypothyroidism, symptoms may include slowing of the heart rate, constriction of the blood vessels, and increased blood pressure. Retention of fluid and edema can cause an increase in the cholesterol level. Severe cases of hypothyroidism can cause heart failure and death. Prevention of iodine deficiency. Fortification. Most common is the fortification of salt. Fortification of salt has a unique advantage among the micronutrient supplements. It requires no change in dietary habits because everyone uses salt. The goal in the prevention of iodine deficiency disorder is universal salt iodization. Programs must take into account possible losses between point of manufacture or import and consumer stable. The best indicator for monitoring the impact of iodine deficiency disorder control program is that salt may be iodized in several ways, including dry mixing, drip or spray technique. Generally, the iodine is sprayed or drip fed on the salt as it flows down a mixing screw conveyor. If the salt is finally ground, the iodine may be added dry. In some instances, international agencies, particularly UNICEF, have been instrumental in introducing universal salt iodization and have assisted producers by supplying the machinery required for iodization process. A customary level of fortification is in the range of 25 to 50 microgram of iodine per kg of salt. These are the conditions that to destroy through food fortification. These are anemia that can be destroyed, rickets, night blindness, goiter, and spina bifida. Next is iodinated bread. Three programs in the Netherlands, Russia, and Sanamia has been used bread as a vehicle for the distribution of iodine. Water has been successfully used as a vehicle for the prevention of iodine deficiency disorder. A cellistic cylinder containing iodine has been used in the boreholes in several African countries to achieve some success in raising community iodine intake, but many associated difficulties have prevented. An ambitious program to introduce iodine into irrigation water in the desert areas of Western China is in widespread use. Now, supplementation, drops and tablets of iodine. Drops of Lugol solution has also been used in schoolrooms. Tablets of salts of iodine, sometimes disguised with chocolates, have been dispensed intermittently. Recently, there has been renewed interest in intermittent dosage in classrooms using tablets or drops containing iodine. Iodinated poppy seed oil has been widely successfully used in the prevention of iodine deficiency disorder since introduction in the late 1950s in New Guinea. Needs may be met for a year or more by a single dose, depending on its size and route of administration. These mixtures have been used both intramuscularly and orally in doses varying from 0.2 ml to several mLs. Iodinated oil has proven to be the most successful, but it requires skilled team, availability of disposable syringes and needles, and carries an attendant risk of infection. Nevertheless, iodinated oil has a well-defined role in the international campaign against iodine deficiency disorder. The picture shows that coconut oil, cottonseed oil, linseed oil, and olive oil can be used. Now, treatment, it is usually treated through eating more foods containing iodine, using iodized salt, and taking iodine supplements. People with hypothyroidism are usually treated with synthetic form of the thyroid hormone, which they will need to take for the rest of their lives. Standard treatment for hypothyroidism involves daily use of synthetic thyroid hormone, levothyroxine. This oral medication restores adequate hormone levels, reversing the signs and symptoms of hypothyroidism. Some treatment drugs are levothyroid, levoxyl, synthroid, and unithroid. If goiter has become so big that it is stretching or compressing nearby structures, or it has become unsightly, you need surgery to remove all or a part of the thyroid. Iodine deficiency at national level. Pakistan is a country with history of iodine deficiency. McCarrison firstly identified regions as severely iodine deficient in 1908. Since then, almost all studies reported a higher goiter prevalence and iodine deficiency, particularly in the KPK province of Pakistan. Pakistan formally adopted the Universal Salt Iodization Program in 1994. These efforts resulted in the decline of iodine deficiency up to 50%. However, the estimated improvement in iodine deficiency disorder eradication is not uniform and may be overestimated. This shows the WHO criteria for Pakistan for about the iodine deficiency disorders. This slide shows a comparison of distribution in Pakistan National Nutrition Survey in 2001 and 2011 amongst the non-deficient and mildly deficient, moderate or severe deficient in 10 years gap. This shows that in 1993, 1999 and 2001 to 2005, how much total goiter rate is seen, median urinary iodine concentration, and household coverage with adequately iodized salt in the graphical form. Now coming towards the recent updates. An article recently published is that the status of iodine deficiency disorders is estimated by neonatal cord serum thyrotropin in Lahore, Pakistan. Cord serum thyrotropin was estimated in the blood of 1295 neonates randomly selected of 25,000 live births from various hospitals of Lahore, Pakistan during the period of 1998 to 2002. Data obtained were used to assess the degree of iodine deficiency disorder in the local population. In iodine sufficient areas, percentage of neonates with a cord serum thyrotropin value of more than 10 milli-international unit per liter is less than 3%. Results indicated that on average 13.5% of the neonates had a level of CST level of more than 10 milli-international unit per liter, which indicates the existence of mild degree of iodine deficiency disorder. Statistically, there was no difference in the percentage of neonates with this level of CST for the 5 years of study. Another article published is the World Status of Monitoring of Iodine Deficiency Disorder Control Program. National monitoring surveys have taken place every 2 years since 1993. Median urinary iodine, initially low, increased to 165 microgram per liter in 1995 and to 306 microgram per liter in 1999, prompting a decrease in the amount of iodine added to salt. The total goiter rate decreased to 20.4% in 1995 and to 8.8% in 1999. Iodine deficiency disorder can presently be considered as eliminated in China. Sustainable elimination of iodine deficiency disorder is within reach and would constitute an unprecedented global success story in the fields of non-communicable diseases, but continuing vigorous action is required to attain this goal. Now coming towards the MCQ session. First MCQ is, iodine is an essential dietary mineral for neurodevelopment among children. The goal in the prevention of iodine deficiency disorder is universal salt iodization. However, which of the following can lead to iodine deficiency? Option A, low intake of fruits and vegetables. Option B, intake only of locally grown food in Central Africa. Option C is insufficient caloric intake, and option D, inadequate sunlight exposure.
Alpha.
Option B is the right one. Only locally grown food in Central Africa can lead to this disease. Second MCQ is, UNICEF has been instrumental in introducing the universal salt iodization and have assisted producers by supplying the machinery required for the iodization process to prevent iodine deficiency disorder. The best indicator for monitoring the impact of iodine deficiency control program is option A, prevalence of goiter among school children, option B, urinary iodine level among pregnant women, option C, neonatal hypothyroidism, and option D, iodine level in soil. Option C is the right one. Most best indicator is C, neonatal hypothyroidism. Third MCQ is a male baby born in the setting of Lady Wellington Hospital through cesarean section. After 4 months, the mother presented with a complaint of yellow colored skin along with a lethargic baby who is having delayed neurodevelopmental milestones. Mother was deficient from iodine throughout the pregnancy. Iodine deficiency in a pregnant woman could result in option A, cretinism, option B, cryptorchidism, option C, chronic hyperthyroidism, and option D, thyroiditis.
Cretinism.
Alpha.
Yes, option A is the right one. It can lead to cretinism. Fourth MCQ is the brain is the control center of the nervous system and it is located within the skull. Along with the heart, lungs, and liver, it's one of the vital organs of the body. These are all dependent on certain minerals and enzymes. Which of the following body part is strongly dependent on the trace mineral iodine? Option A, liver. Option B, thyroid gland. Option C, pineal gland. And option D, thymus.
D.
B.
Thyroid gland.
Option B is the right one. Thyroid gland is strongly dependent on iodine. When the progressive enlargement of the multinodular goiter causes symptomatic tracheal compression, the typically preferred treatment management in otherwise good risk patients is option A, radioactive iodine treatment, option B, thyroid hormone treatment, option C, iodine treatment, and option D, surgical resection of abnormal thyroid.
A.
Option
B.
D is the right one, surgical resection of abnormal thyroid, because if the thyroid is enlarged, it can cause tracheal, and it causes tracheal compression. It can lead to shortness of breath, and that can be damaging. Sixth MCQ is woman presented to OPD with the complaint of dry yellow colored skin of lower legs along with itching. She was diagnosed as having myxedema after all the labs. Regarding myxedema, the following are true, except which of the following? Option A, swollen edematous look of the face. Option B, impotency and amenorrhea. Option C, BMR increased by 30 to 45%. And option D, dullness and memory loss.
D.
Uh, no, option C is the
Alpha.
right one because basal metabolic rate is decreased. As I already told, in myxedema there is bradycardia, and there is all the metabolic rates are slowed down in this disease. Seventh MCQ is food fortification or enrichment is the process of adding micronutrients to food. It can be carried out by food manufacturers or by government as a public health policy. Salt fortification with iodine is an example. A customary level of fortification for salt is in the range of option A 10 to 15 milligram per kg, option B 15 to 25 milligram per kg, option C
Alpha.
25 to 35, and D is 20 to 50 mg per kg. Option D is the right one. Eighth MCQ is a couple is trying to conceive for 3 years, but the results are still negative. On the lab results, woman shows an FSH level of 8.5. LH levels are also within range. However, the thyroid profile shows a decreased level of T3 and T4. Hypothyroidism can cause male-female infertility by option A, interfering fallopian tubes, option B, interfering ovulation, option C, interfering cervical secretions, and option D, by interfering progesterone production. Option B is the right one, as I already told that it causes a decrease in ovulation and release of egg that can cause female infertility. Ninth MCQ is Ali is a 13 years old boy resident of KPK, Pakistan. He is showing stunted growth. On checking the average height of all the children in that area, it was found to be less than average for most of the children. In the endemic area of iodine deficiency, along with the salt fortification process, which of the following should be given to school children? Option A, Lugol's drops. Option B, Bristol drops. Option C, retinol drops. And option D, mefitine drops.
Alpha.
Yes, alpha is the right one. Lugol's drops should be given. Last MCQ 10th is a woman presented to my hospital derma OPD with a history of dry skin, loss of eyebrows, especially lateral margins. She also complains of decreased energy and fatigue. She is resident of goiter endemic area. On her labs, thyroid profile was also done. Physician has the suspicion of hypothyroidism because of iodine deficiency. Which of the following is the earliest sign of iodine-induced hypothyroidism? Option A, thyroid stimulating hormone is raised and T3, T4 same. Thyroid stimulating hormone decreased and T4 is also decreased. Option C is thyroid stimulating hormone decreased and no effect on T3, T4. And in D, thyroid stimulating hormone is same and T3, T4 are decreased.
A. B.
Option A is the right one. Earliest sign is that thyroid stimulating hormone is raised and T3, T4 remains same. This is the key of MCQs. These are references and thank you.
Thank you very much, Dr. Isma. Very nice presentation, and especially how you have covered all the important recent advances and in MCQs.